Hello, I'm Dr. Helmandollar. I'm one of the dermatologists here at Advanced Specialty Care. Today I will be talking about patch testing, which helps patients who may have what's called an allergic contact dermatitis, which is a form of eczema that is very common. We do multiple tests, 80 in total, of the most common inciting factors for an allergic contact dermatitis. Things like hair dyes, which can cause like an allergic type reaction, itching, flaking on the scalp. We also test for allergens that are metal-based. We test for titanium, we test for cobalt, nickel, and these are things found in everyday products to include jewelry, electronics you may use, things like that. Paraben mix, this is typically like a preservative that's found in a lot of different cosmetics, lotions, soaps. A lot of times you'll see products nowadays that will even state on the label like paraben free because this is a very common allergy that we see. We also test for a lot of fragrances, so think of all the soaps and lotions that you may use that have a nice scent to them. Many times that can induce like a skin allergy. Other things we test for, allergies induced by shoes and athletic equipment, and then other things like textile dye mix. So these are things that give color to your clothes that can also induce an allergy. So you'll see it's a very extensive list, and it's 80 of the most common allergens that we test for. So the process itself, what we do is called patch testing. So you come in on a Monday and we place these little squares on your back. Each one of these squares has a potential allergen that I spoke about. We put those patches on your back and then we leave those on until your return visit 2 days later, usually on a Wednesday. At that point, we take the patches off and we do our initial reading. Many times what we'll see at that initial reading is a reaction. And that first reaction that we see on that day can either mean it's a skin allergy, like I was saying with the allergic contact dermatitis, or it may be what's called an irritant contact dermatitis, which is different. That's usually due to direct irritation of the skin just from the chemical itself. The reason I say that is because after we take the patches off on that Wednesday, you'll also then come back on Friday of that same week so that we can do our second reading. And if we notice that the reactions that we saw on a Wednesday go away by that Friday, that means that it wasn't a true allergy and that it falls under that category of what's called an irritant contact dermatitis. And then if we see that either that reaction has persisted until Friday or a new reaction has formed on that reading, then we can deduce that those are indeed skin allergies that the person has. That's the way to kind of determine the allergy. And then we have several methods that we can use to help people avoid these allergens, because it's one thing to know if you have a skin allergy, it's a whole different ballgame to try to avoid these allergens. And we have many different techniques and use of apps and things like that that can help patients avoid these allergies to improve their skin and help with their condition. So what my assistant Callie here is doing is she's applying the various chemicals to the individual wells of the patches. After this, they will be applied to the patient's back. So you can see that each chemical she puts on is a different substance. Again, we test for 80 of the most common skin allergies that can potentially cause a reaction. After she puts this on, it has some adhesive on the outside that allows it to stick to the individual's back and remain in place for 2 days. So this is our wonderful assistant, Mackenzie. I'll be demonstrating just the application of the patches to the patient today. So you can see that the patches that we place the chemicals on prior will then go on the patient's back, and we will leave these in place for a full 2 days before the patient will return to clinic for the removal of them. The patches will stick on very well. In general though, we tell the patients that they need to try to keep the area dry as possible. The only other limitations really is you can't take like any oral steroids during the week that you're on it. But other than that, there's really no other limitations. We do this both on adults and pediatric patients, and it's usually tolerated very well other than some mild itching from the tape. So you can see here that we'll do 80 total. We'll do rows of 4 on top and bottom, and then we'll put some adhesive tape over it just to give it another layer to ensure that it sticks on. Okay, so now we have the patient come back on a Wednesday and we're gonna remove the patches to look to see if there are reactions. She's just an example of this, so we haven't actually left these on for 2 days. But after we take the patches off, if there is a reaction, she would develop like an area that's pink and potentially even has little blistering in the area. And we're able to kind of grade the severity of the reactions with this little device here, which can tell us like how severe the reaction is basically. She doesn't actually have any reactions because again, this is just a demonstration, but if she did, it's very noticeable where those are.